And what I wanted to do is set the tone for this, say a little bit about the context, and try and get us all on the same page to start. I'm going to start probably where many of you might expect, with that triad of issues that's so important in defining the challenges in health policy: access to care, quality of care, and cost of care. I'm going to start with access because in some ways that's where it starts, getting people in the system. Access can be really multifactorial and mean many things, but in our country it has a special association with insurance status. In part because of the developed countries, we really lag way at the rear. We've got 45 million Americans who are uninsured, 8 million children uninsured. And I can tell you that that's not a cosmetic characterization, right? If you're uninsured, you are less likely to go see the doctor. When you see the doctor is less likely to be a regular doctor. You're likely to get less preventive care. You're likely to get less routine care. And I think maybe most startling of all, if you're sick and you see the doctor, whether it's in his or her office, or in the hospital, or in the intensive care unit, you still get less. You still get less. And that shows up in increased morbidity and higher mortality. And it's going in the wrong direction. Since the turn of the decade, we've got roughly 1 million persons more each year who are uninsured. But insurance status is not the be-all and the end-all, and there are many issues in the health care system. And for those of you who are comforted because you've got insurance, it's not at all clear you'll get all the things that are indicated for you. We've become increasingly knowledgeable in recent years that quality of care in America, which we assume is the best in the world, has got real problems with it. The landmark study, I'm proud to say, published in the New England Journal, was Beth McGlynn's work with her colleagues at Rand, and their number was 55%. Some 6,000 patients, and they found 55% of the time patients got what was indicated for their high-quality care. Well, I can tell you it's not just a number like that. I've studied this literature closely, and you can choose the condition: hypertension or congestive heart failure or asthma, chronic obstructive pulmonary disease, colorectal cancer, whatever it is, breast cancer. The chances are 30, 40, 50% of the time you won't get the high-quality services, even if you're in the care system. And it's not just underuse. As Barry said, we've had professors here, Lucian Leap and Troy Brennan early on, who exposed us to the knowledge that the way care is delivered also can have deleterious consequences. And patient safety, we now know, is a major problem. And it's not clearly getting better. The third part of this, and this is going to seem almost like Woody Allen. You know, I've already told you that access is bad and quality is bad. Now I'm going to tell you the portions are small. Well, costs are really just reigning out of control. We not only have a lot of care, but that isn't doing us well, but it's costing us a huge amount of money. In the last 4 years, premiums have gone up roughly 35%, 8.5% annually. The CPI at the same time has gone up 3%. An individual insurance policy costs $4,400. A family policy costs more than $12,000. Let me put that in context. If you were the leader of the median American household, you'd be looking at a pre-tax income of just over $50,000. Imagine what it's like to have a pre-tax income of $50,000 and you potentially have to give, this might be you, especially if you're self-employed, have to give more than $12,000 of that away up front to cover health insurance. Not to mention co-insurance, not to mention deductibles, not to mention the things that aren't covered. And again, there are no signs that this is changing. How do we move ahead? I think we come to convergence in part by pursuing honest, straightforward, forthright dialogue like we're about to have this afternoon. What's going to happen come the new year? I don't know for sure, but I can tell you one thing. I can tell you that what the president does, what he puts on the table, and the strength and resolve that he brings to moving it forward is going to have a huge effect on what Congress may or may not pass.
I would like to follow up Arnie's comments and start off by laying the foundations of what Senator Obama said he wants to do in healthcare. And there are really three things, and they match up extremely well with the things that Arnie told you were the fundamental problems of healthcare. The first point is that all Americans should have access to quality, affordable healthcare. The statistics that Arnie told you about the uninsured are real. The estimates are that about 20,000 Americans die every year because they don't have health insurance. It's a moral issue. It's also an economic issue. Whatever your view is about social and technical change in the economy, you've got to have everyone having health insurance, or else our ability to undertake anything else that we want to do socially or economically is going to be diminished. So everyone has to have access to quality, affordable health care. That is tenet number one. Tenet number two is we need to modernize the healthcare system so that it improves health, it lowers spending, and makes medical practice more rewarding. We cannot continue to have a system that costs 40% more than other countries do, that wastes somewhere between 40 and 50% of all medical dollars on services that are not improving patients' health, that in many cases harms people, and that turns off doctors left and right, gets them not to go into primary care, makes them be embittered about the profession, tell their children they do not want to become doctors, and runs itself over and over again. We need a modern healthcare system that is in sync with where we are, which is to do what it does well, to do it at the lowest cost that it can, and to get the services to people when they really need it. So that is the second tenet. The third tenet is that we need a public health system that works with the medical care system to prevent disease and improve population health. We have major issues ranging from continued need to promote continued reductions in smoking, to an obesity epidemic, to questions about food and water safety and imported goods, and global catastrophes. And we need a public health system that is up to the challenge of doing that, that is not separate and that is not turned into a politicized public health system. Those are the three fundamental parts of what Senator Obama believes. And the way that he judges healthcare reform is by how they reach these three goals. The way that he deals with political issues is by how well they work with him and with each other towards realizing those goals.